This is the Health and Wellness Podcast brought to you by Sanford Health. The conversation today is about the importance of vaccination for older adults. Our guests are Amanda Petrik, Director of Nursing, Good Samaritan Society, Canton, South Dakota, and Courtney Vroman, Director of Nursing, Good Samaritan Society, Battle Lake, Minnesota. Our host is Matt Holson with Sanford Health News.
I'm joined by two nursing directors. Amanda Petrik serves the Good Samaritan Society in Canton, South Dakota, and Courtney Vroman is a nursing leader in Battle Lake, Minnesota. Welcome.
Thank you.
Thanks for being here. We're talking about vaccinations, and let me start with you, Courtney. Why should older adults be getting vaccinations, and which ones are the most common in your setting?
Well, older adults, we really, want to see them get vaccinations. As they get older, their immune system really declines. It doesn't respond as well in its ability to fight off infections and diseases, so they really become susceptible.
What are some of the specifics vaccinations that you're giving to folks?
Typically during the year, the flu, COVID, RSV, and pneumonia are the big ones we hit in our facilities.
And how is that managed in a long-term care setting?
I have a wonderful infection preventionist, and I've also went through the training, so we kind of work well together. But we do set up with Lewis Long-Term Care, and we do have a plan. So the first year we gave all the vaccinations at once, and it was kind of hard on our elders. So now last year we spread it out more so that we got good protection through that fall season. We started with our flu in September, RSV in October, and then we did our COVID November, so they had that great protection through the holiday.
Courtney, what's the process like at your location?
Yeah, at our location, it's really a team effort. We too have an infection preventionist, but we're really looking at resident vaccines prior to them coming to the nursing home. As soon as they come to us, we have the infection preventionist and the case managers who are interviewing the residents, reviewing records, interviewing families so that we can really bring all of that information together. We have a flu vaccine clinic every fall, COVID vaccine clinic every fall, and as well when booster time comes up. So we're really looking at all of those things.
Would you describe this as it's easy to access? I mean, it's very convenient for residents, or how would you describe that?
I would say it's very convenient when you have a good team that works together. And like she said, with a mission, you get that baseline of what's going on and you update and educate. There's a lot of education that goes into it with families because some families are hesitant. So, you just really got to speak to what the recommendations are by the CDC.
That actually leads me right into my next question. Do you encounter a lot of vaccine hesitation at your location?
At our location, it's not unusual to encounter that. We probably encounter it more with new admissions. Usually when new admissions are coming, they're coming to us after a hospital stay, an illness. So their focus is on something other than vaccines. So again, it's really about educating them the importance on the vaccines, the risks and the benefits. And at the same time, you're trying to develop a trust relationship with them. They're oftentimes unfamiliar with our caregivers and they don't have their usual providers around them. So it's really many things coming into place there.
Amanda, what do you do when you encounter vaccine hesitation?
A lot of education. I really do emphasize on the communal setting and how infections do spread quite a bit faster than if you were at home. So it's really important for that primary prevention in nursing to start with your vaccinations when coming into the setting.
What are the risks when you do avoid getting vaccinated? What happens?
Well, there's risk for increased illnesses, disease, spreading amongst not just your resident population, but also over to your workforce population, increased hospitalizations.
I would say that too.
From what I remember, you guys both have high vaccination rates at your location. Can you tell us a little bit about that?
Yeah, we're really excited about that. We achieve high vaccine rates. Right now, we're in the 97th percentile for vaccine compliance rates through Good Samaritan Sanford platform.
When we talk about vaccination rates and having rates that high, what does that do for a community? What are the benefits?
The benefits is I'm going to tell you, and I should knock on wood somewhere, but we did not have any positive cases of influenzas this year. Our COVID outbreak that we did have in January was a minimum of, I think we had 5 that tested positive, none of which had any symptoms. It was just kind of a fluke. The one got tested and I had to test the whole building. So we really know that the vaccinations work because we're not seeing people maybe passing away from like COVID per se.
Courtney, what would you add to that?
Yeah, so I can also add that, usually we end up seeing a healthier community. They're developing herd immunity when they're getting those vaccines. If they do get the illness, oftentimes what we've seen, especially in the last year, is that they've had just a decreased level of acuity as far as the illness goes. So the vaccines are beneficial even if they do get COVID or influenza. The illness just hasn't been quite as strong.
And we talked a lot about residents during this, but this goes for staff too, right? I mean, you're chatting with staff, encouraging staff?
Yes, absolutely. Because of course, if your staff gets sick, then you have other issues that you're dealing with in long-term care, all while you have to continue providing cares to the residents.
Anything you'd like to add to that?
We just really encourage, if they're not going to do their vaccination, that they wear a mask, obviously, and then making sure we're doing great hand hygiene and all the infection prevention type precautions that we do.
Well, thank you for joining us on this important topic. Have a good day.
Thank
Thank you.
This podcast is part of the Health and Wellness series by Sanford Health. For additional podcast series by Sanford Health, find us on Apple, Spotify, and news.sanfordhealth.org.